Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have with us Ben O'Loughlin. He's the back pain recovery specialist, and we'll learn from him about why most solutions fail in terms of back pain and what actually works to create lasting relief. We'll learn about new path to freedom from pain without surgery, drugs, or guesswork. Welcome to the show, Ben.
Thank you so much, Ajay. It's a pleasure to be here and nice to meet you.
You are welcome. Welcome to the show. Welcome to India in this online form. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll talk about freeing oneself from chronic back pain. We'll talk about all this, but let's talk first a bit about you, your background, your journey, so that people know who they are listening to.
Yeah, sure. So I live in Australia. My training at university was in mathematics and engineering, and I subsequently did a music degree. But it was at the university the first time that I experienced really bad neck and back pain, neck shoulder pain. I was getting tension headaches probably 3 or 4 days a week, and pretty miserable. And this was at the age of 21, and this was sort of an old man's disease, but I was living it every day. So that made me, very miserable. And I went and, tried everything, right? I went and saw my doctor, and I went to have massage and physical therapy, and I had acupuncture. I went to a chiropractor. I did yoga. I did stretching, I did meditation, I did all of these things, and nothing really made much difference. And it wasn't until I tried something called the Alexander technique that things really turned around for me. And the very first lesson of that, it made a huge difference. And so I've studied that for 30 years now. I've been a teacher for 5 years, and these days I teach online, and I'm trying to bring the message to the world that in most cases, you have between your ears, you have everything you need to release yourself from back pain.
Absolutely. We'll talk about this technique also later in the show. But first, I want to understand how should people consider back pain? Is it you said about it's all in the ears? So how should they consider back pain? Is it about and how it becomes chronic? Why you talk about misconceptions? Tell us a bit about in that backdrop so that people understand it from a common person's perspective. Someone in a rural area has back pain. Somebody in an office in a small town has back pain. How do they resolve their problem?
Yeah, no, that's exactly what everyone needs to know, isn't it? So the causes of back pain, 90% of the time, you can have an X-ray or an MRI if you have access to those, and nothing will show up. There's no, particular damage or bulging discs or degenerating discs or hernias, or there can be a lot of maybe 10% of cases of back pain. There's damage to the structures of the spine. There's damage to your back that you can see in the pictures of X-rays. But 90% of the time, there's nothing. You can't see anything. That's called non-specific back pain. And those are the ones where there's a combination of factors, but a lot of it is chronic muscle tension. So tension in your muscles creates pain. And then sometimes that pain just gets out of control, and it just goes through your central nervous system. It goes into your brain, and your brain turns up the volume on the pain, and you wind up with a lot of pain that isn't actually due to any damage in your body. It's just you have learned how to feel pain. So those are the sorts of situations where, training what's between your ears, your brain is creating that pain, and your brain can actually learn to release that pain and release the tension that may be causing it.
Right, Ben. What about, aging? People have this thought that, okay, I'm getting old and these things are happening because it's a part of the aging process. Should they think that is right, or is it not the correct way of looking at back pain and correlating with aging.
Yeah, I think, as my father would say, too many birthdays is when I ask him about how his back's going. He says too many birthdays, meaning he feels like he's getting old and his body's wearing out, and that to some extent that's true. There's age-related degeneration in the structures of your spine. It just does wear out, a bit like if you have an old pair of shoes. The sole of the shoes will wear out if you walk around in them for years. And to some extent, that's true of the back as well. There's definitely age-related damage, wear and tear to the structures of your back. However, that's not the only contributing factor. You have people who are walking around age 100 who have no back pain, and you have people like me who, when I was, age 21, I was in crippling back pain. So, age is not the whole story. It's a contributor, but if some people can live to 100 without back pain, then that suggests that it doesn't have to be a life sentence, that you don't have to necessarily suffer from back pain when you're old.
Absolutely, absolutely. So, in your case, you talked about your life. You had neck pain, chronic back pain, and shoulder pain, as well as a near constant tension headaches. How did you solve them for you? Because you studied things perhaps later on. How did you solve it for you? Did you wait for your studies to be over, or do you manage some with some technique and?
Yeah, so I found a teacher of the Alexander technique. In my case, a lot of what was going on with my back pain, was too much muscle tension. I was very tense. My back was tense. My shoulders were tense. I had these knots of muscles I had these knots of tension in my muscles that hurt all the time. And around the back of my skull, I had these. The muscles back here were very tight, very swollen, and that would give me the tension headaches. And the interesting thing about muscle tension is that most of the time it doesn't start in the muscles. It starts in the head, in the brain, and in the spine. And so the muscles usually don't tense themselves. So if you've got really bad muscle tension, you can have a massage or chiropractic or dry needling or some of these manual therapies, and that will make a difference temporarily. It will make the symptoms better. But if you're not changing your brain where the tension is coming from, it's a little bit like it's a light switch that turns the light on. The switch is inside here. So if your muscles are on all the time, like if the light is too bright, you don't go complaining about the light bulb. You go to the switch and you turn the switch off, so the light turns off. It's the same with the muscles. If you want to switch your muscles off, you don't go to the muscles to change that. You actually need to go to the brain and to the spine.
Absolutely, Ben. So, what is this muscle tension all about? Means because you sit for long hours, that creates that tension, or is it some thought process, some stress that creates tension in the muscle? How does that work? How should a common person understand that? Means for them tension is tension anywhere in the head, or anywhere tension is tension. Means for them it is pain. They wouldn't understand it in any other way.
Yeah. So where does it come from? Why do your muscles tense up when there's no need for that to happen? When you say to yourself, why am I tense? I don't want to be tense. I want to try and relax. And you try to relax, but you still have tension and pain. So the tension comes from a few places. As you mentioned, it's stress. When you're stressed, your muscles get tense. It's a evolutionary response. Like a saber-toothed tiger comes out of the woods and your muscle get tense to get the blood into your muscles to get ready for action. Now that's good if a saber-toothed tiger comes and then they go away and then you can relax a bit. But if you're stressed all the time, you have this problem where your muscles are tense. They're always tense. And then that can get locked into the muscles. Bad posture, as you mentioned, is another one. when you're if you have good posture, you don't have a lot of pressure on your joints, a lot of pressure on muscles because you're standing or you're sitting in a way that makes it easy for your muscles. But if you stoop forward, for instance, then there's a whole lot of weight now your spine has to stop from falling. And so there's lots of different ways to stand or to move or to sit, where if you're slumping, your muscles have to work very hard to try and stabilize you, compared with if you're sitting, naturally with good posture. So bad posture, stress. Sometimes people have injuries, and then the injury can heal, but the muscles are still. It's called guarding. Like your muscles are on guard. They're trying to stop anything moving because there's an injury, and your muscles are trying to prevent any movement that might cause damage. But then once the injury is healed, sometimes the muscles are still guarding. They're still very tense, very rigid, because they've learned how to do that, and you have to learn how to relax them again.
Absolutely. So when someone has a pain sort of a thing and it becomes chronic, why these traditional things means we have done a lot of improvement in modern medicine. Why it doesn't work? Where do you come into the picture? Means do they have to only find solace in a technique that you talked about, Alexander technique? We'll come to that. But I want to understand, where does modern medicine stand in terms of back pain? Where does it lack, and where does people then go beyond that modern medicine?
Look, that's a really great question. There's so many billions upon billions of dollars spent on, pharmaceutical medications, like clinical controlled trials, drug trials. There's a whole drug administrations in every country and multinational conglomerate pharmaceutical companies. There's a huge, big industry in treatments. But back pain, which is the biggest cause of disability worldwide. Back pain is the biggest cause of disability worldwide. And a recent article that I read, a journal article, a scientific article, said that 1 in 10 back pain treatments are effective. So we have billions and billions of dollars being spent on healthcare, but we can't solve back pain. So that's very frustrating for a lot of people. I talk to a lot of people who've said they've gone and seen a doctor, they've had medication which works temporarily, they go to a chiropractor, but they have to go every 3 weeks forever, because it only lasts a few weeks and then they start feeling bad again. So a lot of people are trapped in this cycle of pain. If they can afford the treatments, then they can get, regular acupuncture or massages or whatever. But if they can't afford it, or if it's not convenient, then they're just sort of stuck in this cycle of pain. And only 10% of treatments are effective anyway. So it's a pretty sad situation that we as a society find ourselves in. And that's really is my mission, is to try and change that, to make back pain relief treatments available over the internet, so people can study at home. That's my mission.
Absolutely. So let's come to the Alexander technique. What is this technique all about? And if it is already available, why don't they get told about this? Why do our modern medicine does not speak about it if it's available? Because doctors are supposed to cure their patients. I'm sure lots of good doctors know about it. Why are they not telling about? Is it not proven, or what is? I just want to understand it, so that either if they can ask their people can ask their own doctors, or maybe they can learn more about it themselves or through you.
Yeah. Well, some doctors do know about it, and there are very good, doctors tend to believe, and rightly so, they read scientific journal articles to keep up, and they keep up with the latest treatments. And there are some very compelling studies, very persuasive, good studies about Alexander technique that shows that it works very well for back pain. And some doctors do know about it. In fact, my doctor knew about it before I told her about it, and she actually sends people to me if she has problems with people with chronic back pain, because I tend to look after them. But not all doctors know about it, and one of the problems is there aren't enough Alexander Technique practitioners. I did a few calculations the other day, and I concluded that there's one Alexander Technique per 2.5 million people in the world. And given that chronic back pain affects, let's say 10% of the population, then there are 250,000 people to one teacher. So it's just not very widespread. It's hard to find. But if you do have a look, there's some very good papers in the British Medical Journal that show very good results of Alexander Technique conducted in hospitals in London. That the hospitals ran these trials of the Alexander Technique, and they found it to be very effective.
Right. So what is this Alexander Technique, if you can tell something? And can people do it themselves maybe under guidance? Can it be done remotely?
Yes. So Alexander Technique, the guy that invented it, his name was Alexander, of course, Frederick Matthias Alexander. And he was actually an Australian, although he did most of his work in London. And he suffered from a vocal injury. He kept losing his voice, and he was an actor. So losing his voice meant losing his livelihood. And the doctors couldn't explain to him why he kept losing his voice. And he would rest, and then when he would go to recite, in those days, there was no microphones, so you would recite in a big hall and you needed a big voice. And he tried to use his big voice, and he would get sore and he would lose his voice. And the doctors couldn't help him. They told him, oh, you just rest and you just gargle salt water, and he tried that and it didn't really do anything. So he thought, well, it only really happens when I go and recite, when I go and try and talk in a big voice in a big room. So there's something that I'm doing in that situation that is causing me to lose my voice. And he spent years and years and years looking in a mirror and trying to understand. And what he realized was that when he went to go and use his big voice, tense, and he would pull his head back and pull his throat down, and there was this pattern of tension all through his body that was causing stress on his voice. And he figured out how not to do that and how to change the patterns of tension in his body when he was talking. And he taught that as Alexander Technique. Now for me, when I learned Alexander Technique, I didn't have a problem with my voice. I had a problem with my back and my shoulders and my neck, because they were very sore all the time. And it was because I was doing something with them, with the muscles. I was tensing them and tightening them and contracting them, and that was causing me pain. So I used Alexander Technique to learn how not to do that. And that's what we can do with Alexander Technique. It is a way to learn how to control your muscle tension in your body.
Right. So it was about his vocal cords, about his voice. Not everyone is an actor. Not everyone has voice problem. How is it related to the back pain?
Yeah, good question. So the voice is controlled by muscles. The vocal cords are muscles. The larynx, which is the voice box where your Adam's apple is, there's a lot of muscles around that pull up and pull down and pull sideways. And the way he was losing his voice was the tension in all of these was pulling his vocal cords and his larynx, his voice box, into the wrong shape to work properly. And it was making it sore, and you're tired and sore and damaged. Now, for Alexander, this was really where his focus was. He had to change the way he used his muscles in his neck. And he came up with a technique to change the muscles in his neck, but it turns out that also works for changes in the back of your neck, and for changes in your back, and changes in your shoulder, and changes to tension anywhere in the body. The technique that he came up with was very useful for changing patterns of tension and chronic muscle contraction. And since, I think 85% of chronic back pain is caused by muscle tension, then if you can change the muscle tension, you can change the back pain. And so that's what his technique, that was his discovery.
Absolutely. So how does it work on the ground? Means people can watch it, they can tell you their problem, and then you can guide them remotely.
Yeah. So what I do is I run a course. Alexander technique is traditionally taught one-on-one, so in person. So you come to the Alexander technique teacher, you come to their studio, and they help guide you. They teach you. They teach you how to better to change your muscle tension. And what I realized was you can actually teach this online. And I teach a course basically where there's a lot of video instructions where I help people understand the body and the anatomy, like where all the muscles are and why they're tense and what we can do about it. And then I give them exercises to do to develop the skill of releasing tension, because tension is something we learn how to do when we're babies. Maybe we're tense if we're crying, but once we're asleep, everything is very soft, very relaxed. But if we're tensing our back, it's because we've learned how to do that. We may have learned it subconsciously. We don't know we're doing it, but it is learned behavior. And so we can unlearn it. We could learn how not to be tense. And then when we're not tense, then the pain goes away. And that's what I can teach people online, is how to not tense their neck, tense their back.
Absolutely, Ben. Absolutely. There's much to learn and understand about all this. And I'm sure a lot of people would want to connect with you and try and get some solution to their back pain. So what's the best way for them to do so?
Oh, yeah. So come to there's plenty of information about the Alexander technique online. But if you would like to have a look at my website, it's www.backrepublic.com. Back Republic. And there's a link there, an orange button that'll take you to a free back pain assessment. So you can click on the link and then go. It takes about 2 minutes, and you'll learn some more about your back pain and how you can, get started to reduce or eliminate that back pain. So that would be my. And then if you do the quiz, the assessment, then you'll be on the mailing list, and then. The course that I run is not open. I'm not taking anyone at the moment, but I'll be reopening it soon. And if you get on the mailing list, then you'll get priority access.
Absolutely. With this, it's a wrap on this very special edition of the KJ Masterclass Live. Thank you so much indeed for joining us.